So we are joining you from the practice of Resnik and Associates, and I'm joined here by Dr. Rebecca Resnik, who is the founder of our practice, amazing psychologist, conducts neuropsychological evaluations. My name is Dr. Rachel Singer. I'm also a licensed psychologist, and I'm one of our clinical directors. We are talking tonight about red flags for anxiety. So, pop quiz. Here are some symptoms. Thinking about what you know about anxiety, maybe you've heard about different anxiety diagnoses. When you hear each of these symptoms, are there particular diagnoses that you think, oh, this is a sign of that? So if someone is feeling anxious or worried, what diagnosis might that be? If you're like, I don't know, that's okay. If they're worrying about what other people might think about them, if they sometimes feel down about themselves, maybe not so positive, not that confident. If their appetite fluctuates, they lose their appetite one day, they eat more than their body is telling them feels comfortable another day. Their mood is up and down, it changes. Let's say they need help keeping track of their assignments. They have trouble remembering lots of complicated directions. If they're feeling sad or down, if they cry occasionally. And if, let's say, there are times that it's hard for them to say goodbye to their parents, thinking about what those diagnoses might be, these are all actually typical for adolescent development. So the important thing for you to note, when we talk about anxiety, 100% of the population experience anxiety symptoms. It is one of the universal human emotions. Every continent, every culture, we all experience anxiety. We are going to be pivoting a little bit tonight. When does anxiety become a problem? And how do you know that it's a problem? And on that note, I'm going to turn it over to Dr. Resnik.
Hey everybody, I am Rebecca. So great to be here. I am the parent of a wildcat at WJ and a phoenix at North Bethesda, and both of them went to Wingate. I'm a former special ed teacher for Montgomery County, so I'm really thrilled to be part of this and to share with all of you tonight. So if you're old enough like me to remember the movie The Princess Bride, Wesley kind of summed it up when he said, "Life is pain, Highness. Anyone who says differently is selling something." We're all old enough to know that life is pain, life is stress, life is problem solving, in the words of Karl Popper. And so the question is, when do the normal problems and setbacks and stressors of everyday life cross that line from being an appropriate reaction to a problem? Next slide. Okay. So here's one thing I want to start out with. Stress is very adaptive. Okay, we all come from a long line of ancestors who passed on great genes to us. They got anxious at the right time. They got anxious in the right situation when they heard that rumbling sound off in the distance, or saw that funny looking cloud, or said, "Ooh, the river's awfully high this year," or "That sounds like a wildcat." All those people pass down to us the capacity to get anxious about things. So it's a feature, not a bug. Okay, next slide, please. So in all of us, we have various feedback systems between our brain and our bodies. And what these feedback systems do is they set the body budget. Now, your body budget is determined by what you're about to do. So your body budget is figuring out, am I going to do something that requires a lot of energy, like take a math exam or run a marathon? Or am I going to settle down on the couch and snuggle with my sweetie and then go to bed? Your body is constantly trying to talk to your brain about where to set the body budget. How much energy do you need? How aroused do you need to be? And for how long is it likely to be? So generally, our brains and bodies are really pretty good at calling what's needed in the moment. So we have two competing systems. One is the sympathetic nervous system. And when the sympathetic nervous system is activated, as you can see here in this poor kitty who is very upset, that is the fight, flight, freeze system. That is when we use up a lot of energy. This changes our physiology. It changes everything from the size of our pupils to the functioning of our GI system, to whether or not we have to pee, to how much we're sweating, our blood pressure. The whole system can kick into gear depending on what the body budget thinks is needed in the moment. And then we have our sympathetic nervous system. Now, these two can't be on at the same time. So your body's either activating the sympathetic or it's activating the parasympathetic. Parasympathetic is, sorry, you know what? I forgot to slow down. That was actually a really good reminder. Poor Miss Williams. I will slow down. So the parasympathetic nervous system is that system that brings our energy down. And we need that because throughout most of history, most of our ancestors didn't have enough to eat. So conserving energy is a really important thing for the human body. Being anxious, being on high alert is metabolically very expensive. So our body wants to default. This is why we love just laying on the couch, like Miss Bailey said, under a warm, soft blanket, eating apple pie. God, that sounds great, especially for those of us who are close to 50. That parasympathetic nervous system is what calms us. Now, for our kids with anxiety disorder, that system, that hypothalamic pituitary adrenal system that works between body and brain, sometimes gets out of whack. And the body budget for 2 anxious kids is triggering the sympathetic nervous system at times when it would be more appropriate and more fitting, given the context, to have the parasympathetic nervous system on. Okay, next slide. So again, ideally, there's a balance. Ideally, this feedback loop sets the budget really well and sets it well for a given context. So we have areas in our brain down in the limbic system. We have what's called an amygdaloid complex. It's kind of out of date to say like the amygdala is the fear center. You might have said that back in the 90s. We know now that it is infinitely more complicated. But what happens is that the structures down underneath the front part of our brain, these are in charge of activating that sympathetic nervous system or letting us know when it's safe to let the parasympathetic, that calm Netflix and chill system, when it's time to let that one dominate so that we can do things like go to sleep. So ideally, your amygdaloid complex, that part of the brain in charge of determining if there's a threat or if you need to take action, that's pushing the accelerator. Most of the time, when that accelerator in your brain gets pushed, it's up to the frontal lobe, this part that if I could take off my forehead and show you like the judgment and wisdom center of my brain, this is the part that's supposed to put the brakes on. This is the part that if I wake up in the middle of the night, having heard a strange noise, that my accelerator has pushed the accelerator, I want my frontal lobe to say, wait a minute, that's just the dog, or that's just my teenager getting home. So this feedback system where something's pushing the accelerator and something's pushing the brake, what happens if actually the frontal lobe is saying, go, oh my gosh, emergency, danger at the wrong time? When that happens, the body budget gets out of whack. And so you have the sympathetic nervous system turned on at the wrong time. I can activate your sympathetic nervous system with just a few words. That's the beauty of being a human. If I was to yell fire, or if I was to say, oh my gosh, there's somebody at the door proselytizing, or hey, the mortgage payment didn't go through, or I think you're a victim of identity theft. All of these things would push your accelerator and get you activated and stressed. The trick is that the frontal lobe is the one that's supposed to calm you down, but actually it's the one that's driving the car. Okay? So what I'm going to introduce to you in the next 3 slides is what is known in the world of psychological science as the Yerkes-Dodson law. So basically, we have 2 little stress here, this nice man in his wading pool. And when we have too little stress, when that parasympathetic nervous system is turned on at the wrong time, we don't get anything done. We lay around and we put things off and we're not very productive. We also don't learn a lot because we're just sort of sluggish. Okay, next slide, please. But the other side, this is the other piece of the Yerkes-Dodson law, is that when there's too much stress, human brains basically go into this sort of tunnel vision where the body budget is all about, we are dealing with a really bad situation here. And when the sympathetic nervous system is activated, guess what? We are not learning, We're not remembering, we're not thinking clearly, and we're not making good judgments. I guarantee you, if you approach this nice fellow surfing and asked him to do a quadratic equation or learn the states and capitals or write an essay about the causes of World War I, we would get very little out of him. Next slide, please. So all human brains need an optimal level of stress. We need an optimal level of challenge to keep us active and engaged. What we want from school is for school to be like this, where you are focused, you are thinking, you are problem solving, and you're staying above the wave. Next slide, please. So, as I said, humans are very good at reacting quickly to stress. It's hardwired into our genes. All these years of human development, we're so good at having our amygdaloid complex push that accelerator and get us stressed about things. Next slide, please. What we're terrible at as human beings is tolerating chronic stress. Chronic stress is what we all went through during the pandemic. And I was parenting during the pandemic too, so was Rachel. We are all in the same boat. We watched our kids' lives fall apart like a house of cards collapsing in slow motion. And this hard thing for our kids is that all the adults didn't really have any answers. We didn't know what was going to happen next. Our kids have been watching the internet take over. They've been watching great increases in overt racism and anti-Semitism and anti-Latino sentiments. They're watching the political discourse get ugly. So even just the background noise of what's been happening for our kids during most of their lives is that the chronic stress level has been way too high. Next slide, please. The problem when kids are anxious is that sympathetic nervous system revs up really fast. This model basically shows you the difference between a kid who gets anxious in the right moment when the body budget is working and a kid who is suffering from an anxiety disorder. If you look at the lower left-hand side, that's our entry gradient. That's a stressor. So I want you to imagine that you're walking in the woods and all of a sudden you see a rattlesnake right in front of you. Your sympathetic nervous system will do what it was designed to do. You will have a very intense stress response. But now let's imagine that you look down and it's actually not a rattlesnake, it's just a stick. Okay, so when your body budget is working the way it should, your stress level will go down. You'll do what's called down regulation. And that is when your sympathetic nervous system slows down the arousal, you regain calm, and you go on and have a nice walk for the rest of the time. For our kids with anxiety disorders, their entry gradient level of stress goes on and it stays on. Even if it turns out that it's just a stick, the whole hike could be ruined for our kid with anxiety disorder because their sympathetic nervous system doesn't turn off. They are on high alert, they're exhausted, their GI system may not be working well, they're not concentrating, and they're just feeling flooded and miserable. Next slide, please. And I'm not going to explain this whole slide, but for our neuroscience geeks out there, our physicians and biologists and such, the point I want to make is that the longer a human being experiences chronic stress, the greater the risk of depression. So our bodies and brains are so good at adapting, especially when we're kids, especially when we're teenagers, and we're designed for that. Human beings can live in any environment all over the globe. We are adapters, for better and for worse. So the problem, of course, is when a human body and brain are bathed in stress hormones, that changes everything. It even changes how much weight you gain in your belly. Isn't that depressing? It changes your immune system, how all of your glands work, your blood pressure, how you learn. And the problem is, of course, when all of these things happen over time, depression is like right there. And so what we're often seeing is that our chronically anxious kids are also our kids who are struggling with depressed mood. Next slide, please. Why are today's teens at higher risk? Well, let me clue you in. It is not because we are all bad parents. Let me say that again. We are not all bad parents, okay? And there's nothing wrong with this generation of kids. We get a lot of flack, but think about it for a minute. This generation of kids, they didn't invent the internet. They didn't buy themselves a cell phone. They didn't cause a pandemic that had to shut down the schools. They're not the ones out there doing, horrific things to each other and murdering people in the street and filming it like what happened to poor George Floyd. This is not the kids' fault, okay? These kids are in a particularly tough time to grow up. So they have the natural brain development as they move into early adolescence. During early adolescence, that brain is literally rewiring itself around what is the environment like. So our kids are literally having brains that are different now because of the circumstances that they're growing up in. This chronic stress during COVID, a lot of our kids are depressed now. We have social media infecting their lives and bringing all sorts of negativity, yes, some positivity, but it is exposing our kids to negativity and bullying and pornography like no generation ever before. There's political and social unrest. They need to make friends, and yet their social lives have been stifled and basically hijacked for years. Our kids are also at a time in their lives when they're wondering about who they are, their sexual identity, their gender identity, their racial and cultural identity. And this is a very hard time to be trying to figure out who you are, because basically whoever you are, you're finding there's people out there that hate you and think less of you. This is not a great time to grow up. Next slide, please. So, our red flags. What I want to tell you is that anxiety and depression generally don't look like anxiety and depression. It's just like drowning. They say drowning doesn't look like drowning. When kids are drowning, they slip under the water very quietly. The same can happen with anxiety and depression. Here's the red flags that psychologists are looking for when we're trying to figure out if a kid is actually suffering from an anxiety disorder, a depression that comes along with it. And I very sincerely believe that every person who is around children, and I'm not just talking about the guidance counselors, the school psychologists, I'm talking about the teachers, the janitors, the lunch ladies, the security guards. Anybody can save a kid's life. Every single person, you out there right now, you may save the life of one of your kid's friends, and they may save the life of your kid. We all need to know what these red flags are. One of the big ones is irritability. If you have a kid who is all of a sudden really uncooperative, they're not motivated, they're not enjoying things like they used to, they're socially isolating. We often think of these as typical adolescents, but now we're talking about a kid who isn't enjoying anything except like being shut up with their phone or using substances. We're talking about kids who are also having body problems. Their sleep gets messed up when they're anxious and depressed. Their GI system isn't working well, so they may stop wanting to eat breakfast. They may complain of tummy troubles, maybe have some stomach upset, maybe even get constipated because the whole GI system has those same neurotransmitters from our brain floating around in it too. When we see a lot of uncooperative behavior, it is not normal for a teenager to hate you. It is not normal for a teenager to be yelling or throwing things or sneaking out at night. These are huge red flags, not part of normal adolescent development. And trust me, I'm on my third teenager. I know that that can be hard, but these behaviors cross a line. These are red flags. And of course, academically, all of these things add up to kids who have very low frustration tolerance, and they have trouble learning, they have trouble studying, they have trouble even sometimes just getting up and going to school in the morning. So Rachel's going to talk now more about what do we actually do about this.
So I want to amplify Dr. Resnick's awesome message here. Stress can be adaptive, and it's only a problem when it actually becomes a problem, right? So we're looking for two things. We're looking for level of distress, how intense are these emotions, and we're looking for level of impairment. Does it prevent your child or teen from doing something that they want or need to be able to do? Anxiety disorders are one of the most common mental health concerns that we see. There's a lifetime prevalence rate. 1 out of every 4 individuals qualifies for a capital A, capital D anxiety disorder. And like I mentioned, 100% of the population experience anxiety from time to time. So some of those common symptoms of anxiety, we may be looking at children or teens who really, they want to do things exactly right. And it may mean that they have one perfect assignment that comes at the expense of all of the rest of their work. So I will have clients who will do and redo an assignment until they think it's perfect, but then they haven't done any of their math work. Like Dr. Resnik was mentioning, self-care may go out the window. They're not taking care of themselves in the way that they used to. They have trouble regulating or managing that emotion. They're constantly asking you for reinforcement, and they're not able to do things as much independently. And they're not able to solve problems that you think, this isn't really a big deal. Why does this seem so challenging? Anxiety can get in the way. So there are different anxiety disorders that kind of fall under that larger umbrella category. I'm going to walk you through a couple of common anxiety disorders that we might see in our practice. Separation anxiety usually shows up for our younger kiddos, and this is when they have trouble being away from parents, or when they're worried about their safety being away from parents, or they worry I might get sick. It often starts with the I don't want you to go, and then beyond those first couple days of drop off at daycare, it may extend far into the year. So not just I don't really want to be here today, but then they're able to kind of engage behavior that can really extend for quite a long extended period of time. I've actually worked with 18-year-olds who are experiencing separation anxiety too. So it does not just have to be the younger kiddos. Clients who say, I know my parents are in the waiting room. Like I know this in my brain, in part of my brain. Another part of my brain is telling me, what if something really bad happened to them? What if they're not safe? That can be a really scary thought to have. And this sometimes shows up as body complaints. I'm having a tummy ache. I don't feel good. It can sometimes show up as nightmares at night or lots of checking. Where are you? What time are you picking me up? Who's picking me up today? We also see social anxiety disorder. So this is discomfort in those social settings. Typically, someone with social anxiety disorder will say, I want to have more friends. I want to feel more comfortable. This is not an introvert who says, I just enjoy being by myself and I can be with people. It's fine, but my preference is to be alone. This is when you are with other people, you have this very strong fear of evaluation. What are people thinking about me? Or I know what people are thinking about me and it's not good. People are judging me. People are evaluating me. We will often ask, fill in the blank. How would you end this sentence? I am afraid that people will think I'm. The answers I get most often are weird, different, dumb, stupid, a lot of negative labels that we would never say to our close friends or people who love us. But when we have social anxiety, we may have this worry about ourselves. And a lot of times, if you have social anxiety disorder, you do not want to be in the spotlight. Presenting in front of other people can be really uncomfortable. Meeting new people for the first time can be really challenging. I try not to be super scary or terrifying in my sessions with new clients, but I will have some clients who will hide their face or turn away from me or not answer questions because they're worried about what I might be thinking about them. Panic disorder is often experiencing more of the physical symptoms of anxiety. From the comfort of your own homes, I'm not going to force you to do a physical activity, but if you are curious what a panic attack feels like, you can do this experiment. Either you stand up and you run in place for 30 seconds, or you're sitting at your computer, you just turn your head back and forth for 30 seconds. I have a little bit of chronic vertigo, so that turn your head back and forth is like my worst nightmare. For those of you who are able to use the chat box, if you were jogging in place for 30 seconds, as fast as you could, arms pumping, limbs flailing, what are some of the physical symptoms that you might experience at the end of that 30 seconds? What might you feel? And I'm just gonna, in case you can't find the chat, so usually it's at the bottom of your screen. Out of breath? Absolutely. What else? Sweating, exhaustion, rapid heart rate, dizziness. Ooh, yeah, the heart racing, chest pain. What about breathing faster? We might experience a change in our body temperature. So some people get that flushed feeling, really, really hot or really cold, sort of like an icy feeling, sweating, feeling afraid, muscle aches. Yeah, body discomfort. Sometimes we get kind of tension headaches. I haven't run in a little while, so I probably would feel a little sick to my stomach if I did this. It's not a good feeling. So if you're someone who has panic attacks, your goal is going to be, I want to avoid all situations that make me feel this way. Exactly. Well, you guys are smart. Like, yes, we know what this is like. So with panic disorder, we start to associate that unpleasant feeling with a particular situation. It's every time I go to school or every time I have to get a shot at the doctor, I start to feel this kind of uncomfortable feeling. And then we start to say, I don't want to go there because I know I'm going to feel bad. It feels like a heart attack, but it's not. Yeah? And so, again, we may have a little bit of uncertainty. What happens if I have a panic attack? Sometimes there's a worry. Can other people tell? Will they know? Will they think there's something wrong with me? It's not a pleasant feeling. Generalized anxiety disorder. This is where you have a team of writers in your brain who all write future dystopia novels, and they're all like talking about the zombie apocalypse, and they're like, what if, worst case scenario, right? So if we're talking about somebody getting sick, what if you get really sick and you have to go to the hospital? What if you go to the hospital and something really bad happens while you're there, or because you're there and your dog gets sick, or your gerbil chokes on a grape and you're not there to save it? Like, our brain gets so creative with this, right? I have had clients who will say, if I'm going to fail this quiz. If I fail the quiz, I fail the class. If I fail the class, I'm failing 6th grade. If I fail at 6th grade, well, that just means I failed at life. I'm going to end up living under a bridge. Their brain jumps from something small to something really big. And we may notice lots of different fears and lots of different categories. So it's not just one thing. It's not, a specific fear or phobia about heights or bridges. It's all the things all the time. Pretty overwhelming, right? Okay. There are things that we can do to manage anxiety. I don't want to throw shade at anyone else's job, but I feel very strongly that I have the best job in the world. And the reason I feel that is because there are strategies to help manage this. And there is nothing more magical than someone coming in with symptoms of anxiety and leaving with some effective tools and strategies. No strategy, no amount of therapy, no medication cures anxiety, erases it. We do not want you to stop feeling feelings. We're not going to turn you into a robot. We're looking to reduce the intensity. How high does that panic or that anxiety get? We're looking to reduce the duration. How long are you feeling that anxious feeling for? And we're looking to reduce the frequency. How often do you feel that unpleasant sensation? Strategies, my favorite part. Okay, if you only remember one thing from the strategy slides, this is it. Do. We want to encourage bravery. If something is hard or scary, our brains are telling us to avoid. I'm going to have those panic symptoms, or I'm feeling like I can't go to school because I'm scared about being away from my parents. We want to encourage your kids, your adolescents, your teens to try the hard thing anyway. Couple of reasons why. Number one, it's not actually an unsafe thing that they're avoiding, right? If they were going skydiving without a parachute, we would not encourage that. But if they have to present in front of class, there is probably no physical danger in that classroom, right? There's no sharks, there's no tigers. Their brain may be telling them that, but we want to help retrain their brains, right? By encouraging bravery, we are teaching them that we believe that they can do hard things. I am a parent of 2 amazing children, and I'm going to mix up this quote because I was a little tired, but after my second kid was born, I'm backstory, I'm a vegetarian, I'm a pacifist, I really don't get into a lot of fights. The first thing I said, looking at this tiny little nugget, was I would fight a bear for this kid. I have not seen a lot of bears in Montgomery County. If you have seen bears, Please let me know. I'm really curious where they are. Our inclination as parents is often to rescue, and I'm going to suggest we try something really hard, which is instead to empower. By empowering our kids, we're teaching them they have strategies that they can use independently. I am not planning on following my kids to work when they are 35, 40 years old and saying, hey, sweetie, do you need any help today talking to your boss? I want them to be able to manage that internal discomfort themselves. I want to avoid rescuing them. They're safe. They don't need to be rescued. And we also want to discourage avoidance in general. Yeah, don't rescue, empower. That's right. Their brains are going to tell them to avoid, and it is our challenge to encourage them not to do that. When they come to you with these big feelings, I would encourage you, like, don't disregard them. Oh, don't worry about it. It's fine. If they are talking to you about it, it's not feeling fine to them. So instead, you could validate it. That makes a lot of sense that you're feeling overwhelmed. Or I get it. Talking in front of people is hard. Or talking to that person who's been so rude to you all year does sound like it would feel pretty scary. And by the way, if anybody wants a handout of the slides, you're welcome to email us. On our last slide here, I'll have our email addresses. So I'm happy to send this along. We can get really curious and ask open-ended questions. So if your child says, I don't want to go to school today, rather than saying, I don't care, you're going, or what's the big deal? You could say, what is it about school that's feeling really hard today? Is there something you're worried about? The more open those questions are, the more likely they are to tell you. And if they're not willing to tell you in that moment, you could always say, I can see something's on your mind. If you're not ready to tell me about it right now, that's okay. But please know that I'm happy to listen anytime you're ready. We want to accept them as non-judgmentally as we can. We don't want to put down someone else's challenge. That's not actually a challenge. Don't feel anxious about that. I have had the wonderful privilege of running some groups for individuals who feel a lot of anxiety. And one of the really amazing kind of magical things that happens is someone has a fear or a worry, and other people will say, I haven't experienced that, but I can understand why that's hard for you. Or, I don't really know what that's like. Can you tell me more about it? That can be a way to kind of draw them out. And we can also just name it. So if they're physically feeling not well, we can say, something is bothering you. Please don't say, you're lying or you're fine, because there is that connection between our emotions and our bodies. We call it the psychosomatic connection. We're not like a separate set of emotions and a separate body. If their stomach is hurting, it may be anxiety, maybe it's a stomach ache. We're not entirely sure the source, but we really want to encourage them to say, is there something that's upsetting you or stressing you out? What is it that's going on? The language that they use to name their emotions may be a little bit different from the language that you use, right? So you might say, are you anxious? And they might say, no, I'm just a little bit worried. Or I'm just a little bit stressed. Okay. It helps to understand why they're doing what they're doing. You know, if they are overwhelmed by something or scared about something, we want to understand what is it exactly that their behavior is telling us. I love to think about symptoms as a way of communication. Maybe they're communicating, things are really hard for me. Maybe they're communicating, I don't really feel safe, or I don't know how to handle this situation. We want to understand that function behind the behavior. I love the idea of this sort of loving firmness. So rather than just like saying, you know, deal with it, suck it up, we could say, I know this is hard. I also know you are an incredibly brave and strong person. I believe you can do this, even though I know it's not going to be easy for you. Whenever we do catch them being brave, when they do something amazing, it's nice to kind of say that out loud to praise them. By the way, I love that you auditioned for the play. I know you were worried about it, but I love that you put yourself out there. I'll be honest, when I was in high school, that was something that would have been really, really hard for me too. If they are anxious or worried or stressed, I'm just using like all the terms that we hear in our office, we want to redirect it. What are some ideas that you think that you could do? What's helped you in the past? How have you dealt with this before? They may have some really good ideas. And if we focus on the strategies rather than just sort of simmering in that kind of discontent, it may help them feel a little bit more empowered to take action. Now, there may be a point where they come to you and you have no idea what to say. You're like, that doesn't make sense to me. That seems very silly. This is actually a very small problem. Why are they making it such a big one? Rather than diminishing it, simple phrase, thank you for telling me. If you want them to be able to come to you in the future when they're feeling upset or worried or stressed out, thanking them for coming forward, they may be more likely to share that information. It's a way of saying, I'm here for you. I like it when you open up to me about the hard things. And it's also saying, like, I'm not afraid to have these conversations with you, even if it feels a little bit unsettling as a parent. All right, we have some really good news, and I'm going to turn it over to Dr. Resnik. There are some wonderful protective factors here, things that might help buffer against some of the anxiety that our kids and teens might experience. So here are some protective factors.
Yep, protective factors. Let me emphasize that the most protective factor for kids and teenagers is having open lines of communication with you, their parent. That open line of communication, when they really feel like they can come to you when something is wrong, it literally can save their life. And it can save the life of their friends as well. Because a lot of times when kids are struggling, all their friends know. The parents may be completely oblivious. The friend may say something to you if you're one of those trusted parents that, or grandparents, guardians that they know won't brush it off, won't laugh, won't put it down, but will really listen and will try to help. And so there you go, the upper left, strong relationships with family. It doesn't have to be a biological family. I certainly have biological relatives that if I never see them again, that'll be too soon. You can build an intentional family with community, school, your synagogue, church, mosque, even like the Boy Scouts and Girl Scouts, or the local chapter of SMILE, the Sexual Minority and Youth Assistance League. Find your people who are out there, the people who get you, and build those relationships. The old saying is, it takes a village to raise a child. We've been kicked out of the village with this pandemic for a long time. It's up to us as parents to rebuild those connections like you're doing tonight, hanging out here with all of us talking about this. As much face-to-face socialization for kids as you can get them to do. Now, yes, family, I like that very much. Friendsgivings, yeah, I love the phrase intentional family. The face-to-face socialization piece, a lot of our kids had very atrophied social skills. And when you're not practiced at something, you tend to feel very uncomfortable doing it. So a lot of our kids spent the pandemic, like mine, spending way too much time alone in their rooms with computers. And so it's even more important for us as parents, as teachers, as community members, to get them off their backsides, get them off their phones, and get them out having like actual fun in the community. This doesn't have to be expensive. Even Montgomery County has tons of events going on. They have fall festival. Your PTA has like movie nights and book fairs and, potlucks and diversity night. Go downtown to a festival. There's tons of things. There's hikes, but getting them away from that echo chamber of sitting in their room with an electronic device that's letting the internet pour into their little brain. Exercise. There is a huge body of research that documents how good exercise is, not just for our muscles, but for our brain. When we exercise, it improves our mood. It improves our executive functioning. It improves our working memory. It literally can make you smarter to exercise. Exercise also helps us improve our distress tolerance. So if you're physically fit, the odds that you're going to bounce back from a setback are much better. Now, this is easier said than done because remember, our bodies are designed to keep us sitting on the couch. Remember, throughout human history, people didn't have enough to eat. So our body is saying conserve and eat, conserve and eat. I know mine is. But we have to fight that and normalize that exercise is really a part of life. If I could wave my magic wand here in Montgomery County, I would have the school day start much later for high schoolers, and I would have every kid in every grade level exercising for an hour a day. Even 15 minutes a day, according to the research, will greatly improve brain functioning, learning, mood, stress tolerance, all of it. But, word to the wise, if you're not exercising, your kids are probably not going to exercise either. So as adults, we have to practice what we preach. Of course, evidence-based treatment with a licensed professional. And I really need to emphasize, when you're looking for someone to help your child, you need somebody who is licensed or certified. It's fine if it's like a pastoral counselor. Those people go through great training and they have actual mental health credentials. Did you know that a lot of our guidance counselors here in Montgomery County are actually nationally certified guidance counselors? This is like the ultra mega level of guidance counselor. Use these people. That is what they're there for. But again, you want to be very careful because there are a lot of people in this area who are very eager to take your money, and maybe they can help and maybe they can't. But if they don't have a license or a certificate, if they can't point to that kind of credential and oversight, you really need to think very carefully before trusting your child with somebody who is not vetted and not trained. I can't emphasize enough, sleeping and eating. Remember, I talked about how the brain and body feedback system controls anxiety. When our kids are sleep deprived, this sets off that ultra stress system that changes our entire physiology. When kids are depressed, and remember, the big symptom of depression is often irritability and sleep problems. When our kids are depressed and anxious, it impacts their sleep. Our anxious kids have a very hard time falling asleep because their brains are stewing in that little hamster wheel of worries and rumination. And why did I do that? And why did I say that? And who hates me? I sometimes find myself ruminating over stuff that happened in kindergarten. I'm 49. It's still there. So not only making sure that they're in the bed with no electronics in the room, and I mean none. Don't think your kid is actually going to turn off that cell phone, because kids are going to be texting and beeping and sharing and doing all sorts of stuff until around 2 a.m. Get the electronics out, make the room dark, make it quiet. Our depressed kids have trouble with what we call sleep maintenance. Depression messes with your sleep. It changes how your body and brain function. So for our depressed kids, they'll have night waking. And so a depressed kid may wake up in the middle of the night and be wandering around the house, getting into trouble on the internet because they really can't sleep and they can't, establish those healthy sleep cycles. And of course, good nutrition. As I mentioned, the body and brain are constantly communicating. We have the same neurotransmitters, these chemical messengers in our brain that we do all through our body. So the more we can make sure that we are eating appropriately, and I'm not saying you have to be like Shane was talking about earlier and eat a whole bunch of kale. I don't know about you, I can't swallow kale. It's disgusting. But we can have reasonably good nutrition that is not waiting until noon to eat. These kids who say, I don't feel hungry, you got to eat something. When I was teaching at Albert Einstein High School, most of my kids ate like a Coke, a honey bun, and fries for their lunch, and they had eaten nothing before. So is it any wonder that they're irritable at the end of the day and they don't feel like learning, and they sure as heck don't feel like doing any schoolwork? When we take care of the body, we take care of the brain. Next slide. That's you, Rachel.
Now I know I'm not going to share my kale chip recipe with Dr. Resnick.
No, we can, but I won't make it.
So you guys have good strategies. You know your kid better than anybody else. You are the expert in your child. And there may be times where you say, I need backup, right? If you have any concerns about safety, your child's safety or someone else's safety, if they mention or you have an indication that they're engaging in self-harm, hurting themselves on purpose, cutting, engaging in other kinds of self-harm, you see that symptom of withdrawal, they're no longer present, they're not interacting with you, they're not interacting with their friends, you see a dramatic change in their food intake or eating, or if every strategy that you tried just does not seem to be diminishing the problem, The wonderful news is you are not alone. You can always contact 211, for the Maryland resources. We've got our 988 hotline if you have concerns about suicidal ideation, thoughts about ending their life. And you can always reach out to your primary care doctor or pediatrician. Those are great places to start.